Onto this now. The global response to AIDS is said to be under threat. According to data released by UNAIDS, progress on HIV prevention has slowed and resources for HIV are depleting. Of course, South Africa is no stranger to the fight against AIDS. So let's unpack what the data has revealed about our country's response to this. Bring in the UNAIDS South Africa director, that's Eva Kiwango, who joins us via our video link for more. It's great to have you on the program, Eva. Thanks very much indeed for making time. This report released by the UN is aptly entitled In Danger, and that's because it shows really powerful data about how, as I mentioned, resources are depleting, HIV prevention has faltered, and in part, this is because of what's been described as global shocks. What are some of those?
Thank you very much. Warm greetings, and thank you for the opportunity to talk to your news channel and your new report. So the report on the global HIV response reveals that during the last 2 years of the COVID-19 and other global crises, including the war in Ukraine, progress against the pandemic has faltered and resources have shrunk and millions of lives are at risk as a result of that. This is a wake-up call for the world that we are not making progress as fast enough in the response to the pandemic, as you've stated. There were 1.5 million new infections worldwide last year. In South Africa, there were 210,000 new infections. And this is 3.6% less than the year before, which means we are way off track in terms of reaching our target of ending AIDS as a pandemic by 2030, the SDG, the Sustainable Development Goal target. And some of these increases are very stark in countries like the Philippines, Madagascar, Congo, and South Sudan. The report also shows that efforts to ensure that people living with HIV are accessing life-saving antiretrovirals are faltering. And the number of people that we put on treatment grew more slowly in 2021 than it has in over a decade. So these are some of the shocking numbers, and we know that within these numbers, of course, we have to understand there's a lot of inequity as well. And, you know, a stark example is the one on treatment, where we see that even though South Africa has been able to facilitate 94% of all people living with HIV knowing their status, and 74% of them, or 5.5 million people on treatment. We're seeing that there are inequities in terms of adult men. Only 55% are on treatment compared to 68% of women. And there's even further inequity between children and adults. Sure. The report also highlights that we have not eliminated the transmission of mother-to-child HIV, which is important. And lastly, that the financing for HIV globally has gone down. And this is, of course, due to these crises, as I've mentioned. And the funding has significant impact, even though South Africa funds most of its HIV response. It still relies on 20% external funding. Right. So when we see a contraction in funding for HIV, it's an alarming statistic.
Yeah, really sobering, all those details, all the indices pointing to the wrong direction. Perhaps we can hone into the situation in South Africa with a bit more detail, if we can. I mean, for instance, we do know that condoms are just one of the many ways through which the virus can be managed, its spread. But we're also learning that inequality in the country, unfortunately, is making even that a bit of a challenge.
Yes, inequalities our new global AIDS strategy emphasizes the importance of ending inequalities in order to be able to end AIDS. We cannot treat our way out of this epidemic. So yes, inequalities have to be addressed. And inequalities, when I talk about inequalities, I'm talking about things like poverty, things like hunger and violence, that are factors that put people at higher risk of HIV infection and increase their marginalization in society. I'm talking about stigma and discrimination in communities, in healthcare centers, that deter people from seeking HIV prevention, treatment, and testing services. Some groups of very vulnerable populations like young adolescent girls and young women, key populations like sex workers, men who have sex with men, transgender populations, people who inject drugs, are not getting the information and health services they need. So we really need to address inequalities, the inequalities that prevent certain population groups from accessing services, but the inequalities also in relation to knowledge, in relation to accessing information about the choices that are out there. We have to address inequalities in access to technology, especially new technologies. We need to make sure that once the science has confirmed the efficacy of these technologies, that they're available. Technologies like the Depivrin ring, making sure that the choices are in these technologies are included in our prevention baskets, and that the choices are made available for these very vulnerable populations. We need to end. Only way we can end inequality, end AIDS, is if we address inequalities. You
spoke, Eva, about vulnerable groups. Part of what we've also learned through this report is that women who live with HIV are also, I think it's about 6 times more likely to develop cancer. That must be driving up the mortality rate in some ways.
Yes, cervical cancer is definitely a non-communicable disease that is, plagues women living with HIV. I don't have the statistics on me right now, but absolutely cervical cancer is a big issue. And as you've said, the gendered impact of HIV is well known, and the crises that we have gone through, including COVID-19, where we saw lockdowns and girls were not able to go to school, have contributed to spikes in teenage pregnancy and spikes in gender-based violence, which are putting these girls and young women at higher risk of acquiring HIV.
So much to take out from this report. Hopefully it lands in the hands of those who have the decision-making power to finally turn the tide, especially given the disruptions you've outlined. For now, Eva, let me thank you for your time. Really do appreciate giving us a snapshot, really, of some of the key findings from this latest UN report. Eva Kiwango is the South Africa Director with UNAIDS. Once again, thanks very much indeed for your time.